Hey guys, welcome back. Now, some people wanted a little more information on the knees, and I know that the joints are problematic areas, especially in Tai Chi Chuan and Qigong, martial arts. So the hips and the knees and the ankles we really need to be cautious and careful with, and really need to spend time with the self-care aspect, especially if we're really trying to push our bodies to the limits. Now, we know that consistent practice really puts us in a place where we can excel and progress. However, what we're not given a lot of times are the ways to rehabilitate the tissues and the cells, recover efficiently, and what I like to say, recharge for the next day or the next session. So in this particular video, I'm gonna show you some massaging that I do for the tissues around the knee. Now, we'll look at some diagrams and we'll see that the tissues cover the knee. So from the hip joint, you have two muscles that come down the knee and they attach to the bones under the knee. And then for the calf muscles, we'll find that those calf muscles attach to the femur, the bone above the knee. So you see that you have this sort of interlocking, webbing of the muscles around the knee joint, which can be problematic if these muscles are not cared for or dealt with. What I'm focusing on right now is the connective tissue. So the ligaments and the tendons of these muscles around the knee joint. Okay, so let's get into it. I'm going to show you some massaging, and what we like to do is move from the top to the bottom. So let's say like the hips down to the feet. So above the knee joint, and then I'll show you some points on the knee joint, and then below the knee joint, the calves, and then the shin. All right, let's get into it. So here are the three main tools: brushing, tapping, and scratching. I'll show you a few more. For now, let's focus on these and notice the amount of pressure that I'm using. You can see that the skin is starting to react and get red. So we use the term vigorous. Brush vigorous. So this is how you start the routine. You warm up the hands, and this is similar to our meditation recovery as we come out of meditation and we're massaging the body. So notice how I brush the hands. Now I'm going to the knee and I'm brushing the knee. It's brushing in a circular fashion, and I'm using the contact of all the fingers, using the contact of the thumbs, the thumb pad, and the palm. So that whole surface area, and you can see I'm brushing in a downward area, and a downward movement rather, toward the feet. So that's important. Keep in mind that we always want to move toward the feet. This is a light brush here, and from here I move to scratching. Scratching stimulates the skin, and scratching allows stagnation to surface up to the skin and then move out of the skin. Now, tapping. Tapping is a tool that we use to get deep between the bones into the joint and even inside the bone. So after that small sequence, now I brush. Brush is kind of like your reset. Brush is your in between. And I just did a whole surface of the knee there. Now we're going to go into the connections of the knee. We were talking about the ligaments and the tendons. I'm using a squeezing motion and a pinching motion and kind of like a claw motion. I'm using both hands. See how I interlock my fingers, and I'm squeezing from the top and the bottom, so using my thumb and also the fingers. I'm using a turning motion as I squeeze.
So I'm using the surface area of the thumb pad, surface area of the fingers, and squeezing. So I'm really engaging my fingers, engaging my hands, engaging my forearm muscles. And I'm just rotating that surface area, rotating the pressure that I'm applying my squeeze to. And here I like to do a little bit of a squeeze and a rotation, squeeze and a rotation, squeeze and a rotation, all to loosen the attachments, the ligaments and tendons. Now here I'm focusing on this particular muscle. This is the vastus medialis obliques. And you can see the other side of the knee there. I can even do that muscle too. But I'm using both thumbs to put pressure into this part of the knee, this part of the leg here. And the underside, I'm using and targeting the lateral hamstring tendons and the semimembranosus there. That's the fingers there. And then I use the thumbs to target the side of the leg there, which is the IT band, that white area between all the red area on the side of the leg there. I get the lower section of it. Now we're going inside the knee joint. So we call this the eye of the knee, and acupuncturists put needles in this area. So let's take a look. Now the meniscus is supposed to be like a fluid sac that keeps space and prevents the bones from sort of grinding against each other. We have to figure out how to get in between there and stimulate the cells of the meniscus for regeneration. And this is how we do it. We use the fingers to project the mind and the intention in those areas. So I'm putting pressure of the fingers into the eye of the knee. Here I'm using a little bit of an angle and a little bit of a distance to use the thumb and use the finger to apply pressure into the eye of the knee and then also the muscle of the thigh there. As I mentioned, we're going to go down to the calf muscles and the shin muscles. Now we're using the same squeezing and pinching to get to the attachments of the calf muscle here. So as you do this, you should find that this is actually feeling really relieving. So we're getting the lateral head and the medial head of the calf muscle there. And then the front part, using those fingers. I'm using the fingers here. What you can't see is the thumb pressure here. You can see the finger pressure in the shin area, the tibialis. But what you can't see is the thumb pressure that's also going into the calf. So you can go as far down as you want, even down into the ankle there. And now I just use light pressure here from the knee to the ankle. Remember, we want to move at a downward motion. And I'm using my left hand there to support the leg, support the whole knee as I massage with the right hand. Here, look, you can see I'm doing a brushing. This is how I finish. So the brush is surface. The scratch is semi-surface. And the tapping is deep. So let's review. We got brushing, scratching, and then tapping. Tapping goes deep into the bone. Scratching leads the energy out to the skin, and then brushing moves away from the skin down. So this is how you can remember. So brush, tap, scratch, brush, scratch, tap. And then how we got to the ligaments, or the tendons rather, was squeezing, pinching, and pressing. You can see my pressing there along with squeezing. And then getting into the eyes of the knee. getting into the meniscus area there, even the articular cartilage of the knee. Super important if you're really trying to restore. The problem is with these areas that it's so hard to for cell replacement to happen, because cell replacement happens where blood can flow easily, and in these connective tissue areas, the blood cannot flow easily. So I hope that helps. Any questions, contact me, let me know.